This study was part of a larger collaborative effort between Mayo Clinic and our colleagues at Purina. This study was designed as a randomized controlled trial, with the main objective being to study the direct physiological and emotional impact of a 20-minute animal-assisted activity session in patients with fibromyalgia. My name is Arya Mohabit. I am a physician in the Division of General Internal Medicine at Mayo Rochester, and I'm a member of the Fibromyalgia and Chronic Fatigue Clinic team here at Mayo Rochester. And today I'd like to discuss our upcoming publication, the impact of a 20-minute animal-assisted activity session on the physiological and emotional states in patients with fibromyalgia. And this is a manuscript that will be published in our Mayo Clinic Proceedings. This study took place at our Fibromyalgia and Chronic Fatigue Clinic here at Mayo Clinic in Rochester, Minnesota. We were able to enroll 221 patients that we diagnosed with fibromyalgia, meeting either the 1990 and or the 2010 American College of Rheumatology criteria. All of our patients were randomly assigned to either one of two groups, the intervention group or the control group. The intervention group consisted of a 20-minute animal-assisted activity session in which the patient was met and had a session lasting 20 minutes with a therapy dog as well as with one of the handlers of the dogs. The control group was a 20-minute interactive session just with the handler only, so there was no therapy dog in that setting. We enrolled a total of 19 therapy dogs, and these are all members of our Mayo Clinic Caring Canine program. What we did in this study is we wanted to assess a variety of physiological and emotionally based parameters and biomarkers. Prior to the intervention, we surveyed all of our human participants with a variety of surveys looking at their fibromyalgia impact scores. This is called the Fibromyalgia Impact Questionnaire. Essentially, how much does their symptoms impact their daily life? We also had them fill out visual analog scales on both positive and negative mood experiences, as well as a variety of pain scores. We then had both the human and canine participants obtain a variety of physiological biomarkers, including tympanic membrane temperature, salivary cortisol, and salivary oxytocin. We then had both the humans and the canines get equipped with heart rate monitors. Our intention was to have heart rate variability measured throughout the entire experience. And again, when I said this is part of a larger study, the first part of the study was looking at how did the therapy dogs themselves fare as a result of being in one of these therapy sessions. And the second part of the study was looking at how did the human participants with fibromyalgia do as a result of having the intervention of an animal-assisted activity session. So then the intervention took place. It was a 20-minute session, either with the dog and handler in the intervention group or the handler only in the control group. And then after the experience, we again surveyed the patients with the same Fibromyalgia Impact Questionnaire, the visual analog scales and the pain scales, and again got temperature readings, salivary cortisol, oxytocin levels, and we were able to remove the heart rate monitors on both the humans as well as the canine participants. Overall, our results, when we compared our intervention group to the control group, demonstrated a significant reduction in the Fibromyalgia Impact Questionnaire scores in our intervention group. We also saw a notable decline in the pain score scales. We also saw a significant reduction in the visual analog scales for the negative emotions and a significant rise in the visual analog scales for positive emotions. We also saw a significant increase in salivary oxytocin, which is consistent, which is more of a positive hormone. So you can assume then the patients were in a more positive state as a result of the increase in salivary oxytocin. We saw no significant difference in the salivary cortisol, which is a stress hormone, which we then took that to conclude that there was, again, no significant worsening. And again, patients were either in a stable or more positive emotional state. We also saw a significant increase in both right and left tympanic membrane temperatures, but we saw a greater increase in the left tympanic membrane as compared to the right. And so this is an overall left to right increased laterality in tympanic membrane temperature, which is consistent with patients being in a more positive emotional and physiological state. We also saw a significant reduction in our intervention group in terms of heart rate, showing that they were in a more relaxed state. And we also saw a significant increase in a variety of heart rate variable parameters. Overall, we concluded that with all of these results, that the patients in our intervention group, so those that experienced both the handler and dog, the 20-minute animal-assisted activity session, they were in a more positive emotional physiological state as compared to our control group. We then surveyed our participants and asked them what they thought of having the animal-assisted activity session. And we had over an 80% agree to strongly agree response that animal-assisted activity was helpful during their time in the clinic. And over 90% agreed to strongly agreed that they would recommend an animal-assisted activity session to one of their colleagues or other patients. This was a joint collaborative effort, and by far it was the largest study and most thorough study trying to assess both subjective and objective measures in terms of the impact of animal-assisted activity in patients with fibromyalgia. We were very fortunate to be able to partner with our colleagues at Purina, and they were actually able to create a new biological assay measuring salivary oxytocin in our canine population. So that was a great experience in that sense. In terms of how does this finding relate to clinical practice, I think healthcare professionals should strongly consider implementing animal-assisted activity as part of the armamentarium or treatment regimen that we have when it comes to treatment for fibromyalgia. In fibromyalgia, we like to think of things as being medication treatment strategies and non-medication treatment strategies. And animal-assisted activity would definitely be a non-medication treatment strategy. It would be a component of what we call complementary and integrative medicine. And at this point, it is already being utilized in many different clinical arenas, including cancer care, psychiatry clinics, pediatric clinics, post-surgical clinics, as well as post-surgical interventional areas in the hospital, as well as in a variety of emergency departments. So our thought is it would be great to incorporate animal-assisted activity as part of the treatment regimen plan for fibromyalgia. In terms of what this means for our patients with fibromyalgia, this is yet another tool that they can utilize in the treatment of fibromyalgia. Unfortunately, at this point, I can't say that we have a cure for fibromyalgia. We have symptomatic treatment, and based on the evidence that we are seeing in this study, a simple 20-minute session leads to physiological and emotional improvement in patients. And I think future studies looking at what is the optimal animal-assisted activity regimen to set up would be a wise line of research to proceed with. I'm also interested in looking at what is the actual duration of these improvements. Ours was a single 20-minute session. If we do multiple sessions, is more of a good thing leading to a longer lasting improvement. That is something that we hopefully can study in the very near future. Other potential avenues for research with this study would be assessing additional outcome measures, whether an animal-assisted activity leads to future reduction in healthcare resource utilization. Does it lead to any medication usage changes? Are we able to scale back on some of the other potentially harmful medications that patients might be on as a result of implementing this treatment option? And whether or not there would be any other functional changes that patients might see in terms of their daily abilities and their daily activities of daily living. Would those improve as a result of implementing animal-assisted activity? So honestly, I think this single study has brought out a lot of other potential avenues and questions to move forward.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.